braces and orthodontic work because you're just not worth the investment. We would never say that. So this is kind of the same thing. You know, what we do in our wellness programs is teach people. We show you the aha, we enlighten you, and we teach people how to safeguard your health for life, just like Reese has straightened his teeth out for life. So it's really important, and that's why we work so hard to put things into a manageable place for people that is affordable and manageable. And you know, most functional medicine doctors, every visit you go into is probably $500 or $600 because they're working so hard to help you. So I don't do it that way. We have other constructs, but it is some investment, or else I just simply can't do this. My practice would close. I would go bankrupt. So when you come in for a consult, no, I'm not solving all your presence in that problems in that visit, and you are going to have to make some level of personal investment akin to putting braces on your kid, but that's okay because you are going to feel better, and it's going to be the best thing that you've been able to do for yourself and the most return on any investment that you've ever done, because your health is really, truly priceless. And you ask many of our patients, and they're going to rah-rah that over and over again. Another common question people ask me is, can I help everybody? No. Sometimes people really just aren't ready to take action. And like I said, we work with 15 to 20 patients. We make a group every month that we move forward with. And it's important to me that everybody I'm spending all this time and energy and making my brain work really, really hard is going to take action and get better. And that's really important to me. So I kind of gather that from you when we're going through our consult. And then some people have just waited too long. I mean, there's some point at which you've gone too far and you've waited too long to really move on what you need to do. People also ask me, can you help me if I'm busy? And I always laugh. I laugh at that. It's like, I promise you. When this is part of your life, it gives you so much more time and energy once you get through the initial learning curve. Me being a mother of 4 little boys, 8 and under, and an obstetrician, and like running my own practice, nobody does that anymore. It's the only way I can do what I want to do. So busy, but the only way I function is by living the wellness components that we teach our patients. So absolutely, it's okay for busy. That you're gonna make it. It's gonna be okay. We're not superheroes. You know, everybody that does this with us, I have a few superheroes, maybe, that are just perfect all the time. But everybody's normal people who just made a decision that they're gonna change and they're gonna do things the right way and not the ridiculous, idiotic way that most people are going through their life. This is Charlton. I love him. He's married to one of my good friends, and she brought him. She's like, please help. She's about to get married. Please help Charlton. All of his family has diabetes. He feels terrible all the time. He thinks there's nothing wrong. Men are like that a lot. We think, sorry, James. Everything's fine. I have no problems. And I was like, okay, you have no problems. So I showed him all the problems that he had, and I thought he was going to be really a pain in my butt. But when he started, because I was just like, I'll do this as a favor to my friend, or I'll try to help him. When he started learning and he got in the groups, like his competitive nature came out, and you know, he was doing CrossFit 3 or 4 times a week and still weighed over 300 pounds because of how much inflammation and all the insulin problems he had, his thyroid problems, and you know, these crazy allergies that he thought were from grass. When he learned, he's like teaching all of his friends. He's like, I go to work and people are looking at me like I'm crazy. So I'm like, this is what you need to do. And it was amazing. He's a normal guy. He just learned the right stuff and decided it was important and that he didn't want to end up like his family, and he did it, and awesome. He's great. Mallory was another patient that came, and she's young. So I was really proud of her for taking action. She had horrible PCOS, was having fertility problems, had seen so many people, and it was really hard for her to wrap her head around. Like most people, it's not the problem you think you have, it's all of the underlying issues that we need to address. But she's not a superhero, but where she is now is right here. And it's amazing that 4 or 5 months, was it like 4 months? After Mallory started working with us, she got pregnant, and then we got to have the fun of going through her pregnancy and knowing that she had brought her child into such a healthy in utero environment and impacted this little guy for his life. So we are finished now. I know I can go on and talk all night. I get so excited. 3 last little things I'm going to share with you. Little rules that we have. So Linda and Brittany are here to schedule a consult for you. That that paperwork we give you is really important to me. Don't half-ass fill it in. Okay, I'm gonna be really sad when I consult with you. So take the hour it takes to fill it out and fill it all the way in, because I need all of that information. And we're spending, 30, 40 minutes together. I wanna maximize that time so we can figure out what we need to do and how we're gonna move forward. If you're married, or you have a significant other that you're probably gonna marry, or that you care deeply about, that's part of your life, it's important that you come together. And that's, I know it's sort of annoying to try to organize, but it's really important to me for a few reasons. For one, I work with a lot of women who tell me my spouse doesn't care, or they don't get it, or they think that I'm just whatever. Well, you get me on board, and I'm gonna fix that, I promise. I do it all the time. They need to be on board and understand what you're experiencing and what you're going through, and you're making an investment decision. And as a person who's married, I respect that we make those kinds of decisions together. So it's important that you come together so you don't have to backtrack and have to help someone else understand by yourself, when I can do a whole lot better job helping that person understand. If you're already on dating sites looking for somebody else, then you don't have to bring them. They're on the way out, so no problem. But do make that. You're gonna go get on the dating site? Okay, that's fine. You don't have to bring the current one that you're picking out. And then lastly, make sure you come on time. I know normally when you go to the doctor, and on my OB-GYN days too, or if I'm delivering a baby, I might be running behind. We're always super behind. On these days, we really try to stay on schedule because our appointment slots are so much longer. So do make sure that you come on time. If I'm delivering a baby, I'm sorry. I'll try to catch up. That does happen. So Linda and Brittany are here. Make sure you eat some more snacks and drink some more kombucha, and I look forward to seeing you all down the road some more.
Will
Yes.
we always meet here once we get together for group sessions?
Mostly, yeah. There's a couple of classes that Brittany will do off-site at fun places, but for the most part, you're here.
Okay.